Are you one of the millions of people who suffers with a condition called lupus? Have you been told that your own immune system has started to attack your body, attack your own tissues, that your own immune system has turned on your own body and that's what's causing your problem? Yet the doctors don't know why the autoimmune disease or the immune system attacking your body, why that's occurring? Have you been prescribed anti-inflammatory medications as well as immunosuppressant medications, which have provided you no relief? Or maybe they did provide you some relief for a short period of time, but you're noticing that those symptoms that those medications relieved you from, the symptoms are returning. Is that your case? Is that what's going on with you? Did you get no relief from the medications? Are you still getting the rashes on your skin? Are you still having inflammatory joint pain episodes and muscle pain, or even constipation or insomnia, or even emotional stresses from your condition? My name is Dr. Lonnie Herman, and I'm going to share with you in this video update on a patient who's 42-year-old female who came to my clinic in South Florida from, she lives in Georgia, and she has been living with her lupus diagnosis since 2012, April of 2012. This right now is April of 2017. And she lived with her symptoms prior to being diagnosed with lupus. She lived with symptoms for about a year prior to actually getting that lupus diagnosis. And they prescribed her for her lupus diagnosis and for the symptom relief, they prescribed her low-dose naltrexone, prednisone, and plaquenil. And these medications, while they helped her for a short period of time to relieve some of these pains, which I'll mention in just a few minutes, she noticed that the symptoms just returned and she had no relief after a while of taking those medications. I will report to you in this video not only the symptom relief that she's experienced after following her first protocol from my unique work that I offered her, as well as what the findings were in her first exam and now the findings from her second examination or her follow-up examination after she's already experienced so much relief from symptoms. So you may be familiar with some of these symptoms that I'm going to report here right now. Again, 42-year-old female. She had swelling and pain in her joints that was at a level of a 10 in severity. Now, she even called it a 10 plus, I believe, where 0 to 10 is the range that we're talking about, and 10 is the worst, most severe pain. 0 means that there's no pain. She said that her joint pain was a 10 even with taking her immunosuppressant and anti-inflammatory medications. Even she's also taken in her past a lot of antibiotics as well for her condition. And the joint pain was a 10 with meds pre-care. Right now she states that her pain halfway through her first protocol, which she started with me in mid-January of 2017, halfway through the protocol she said her joint pain had reduced down to a 5 in severity. And now when she returned to me this April 3rd of 2017, her joint pain was completely gone with no medication use, complete resolution of her joint pain without using the prescribed immunosuppressant or anti-inflammatory medications that they provided her, as well as the low-dose naltrexone was not being used anymore. And this was all following my protocol, which I will report to you exactly what those findings were. She also reported that she had an extreme sore throat, and that could keep her up at night. A sore throat was happening at any hour of the day. There was seemingly no rhyme or reason to the sore throat. She said that the sore throat was completely or just about completely gone. It's much less extreme. She does notice that the sore throat is occurring now with pollen in the springtime, which it happened at any other time in the year, at every and any other time in the year before this care. So she notices with certain foods and with the pollen that she still is getting a sore throat, but it's much less extreme than what it was before. So we have made a lot of gains with that symptom relief. And I'll report to you why I believe that the pollen in the foods are still driving that soreness. She also said that she had a shoulder blade pain that was a severity of a 10, and that was more of a constant pain that was any time of the day, any time of the night, all day, all night shoulder blade pain, a severity of 10, when 10 is the most severe. Her pain now, she said it's a 2. When it gets most severe, it's a 2, but now it happens every now and then, or as we might say, it's on and off with the pain, but it never has reached the 10 severity, now down to a 2. Sometimes it's at a 0 where there's no pain. She also mentioned that her symptom of inward trembling, which she had as a constant or pretty much constantly prior to this care, even when she was on her prescribed lupus medications, her inward trembling has totally disappeared. Her nervousness, her inward nervousness has totally disappeared. That was constant. That was pretty severe before we met. She had heart palpitations, which were a constant, and those completely disappeared during the protocol, even up until she drove down here on a 10-hour drive coming down to my office in Florida. I believe that the time in the car that caused the heart palpitations to come back slightly was because of the electrical stress, the electromagnetic field stress from the 10-hour drive. We can discuss more about that later, but the heart palpitation was completely gone until she drove down here to Florida. So something had occurred there. And again, I believe it's the electrical stress from the vehicle. She said that she was insomnia. She suffered insomnia where she could barely sleep at night. She'd fall asleep and then wake up and just stare at the ceiling or look around the room and was not able to fall back asleep. Or she'd wake up and she'd be up for about an hour and a half or 2 hours, fall back asleep and wake up again, and up for another hour and a half or 2 hours, fall back asleep to wake up again. She never had a complete night's sleep. She suffered with that for years. She said her insomnia is completely gone. The only time she wakes up at night now is to go to the bathroom, if that is even the case. She can fall asleep at 9:30 in the evening and she wakes up around 5 or 6 in the morning. So that's a great, let's say between 8.5, 9 hours or so of sleep, of good solid sleep following this protocol. She said that with that joint pain that she's had from a 10 in severity down to 0, she did mention that there could be time, maybe it's caused by the food, we're still going to figure that out with her, but where she did have a little bit of discomfort where she had to take an ibuprofen, and that brought complete resolution from the joint pain when it did occur in a slight manner, slight severity. I wouldn't even call it severe, just a mild case of the joint pain. So we've had great resolve from these symptoms after this, during and after this first round of care. And again, I want to state that she made her own decision to get off of her lupus prescribed medications without what I said. She prescribed them. I'm saying it wasn't my recommendation to get off the medications. She decided that on her own to get off those meds, and we're already seeing great improvement. There's still more work to be done with her to get her completely well. I'm going to tell you that after a complete and very thorough consultation for her first round, as well as the second examination process, we were able to really pinpoint which kind of hidden infections and toxins were and are causing her chronic so-called, and I say so-called autoimmune disease. I say that because this term autoimmune disease is not truly understood by many people in the medical world, and what's reported by the drug companies, that your body is just attacking itself. It's attacking tissues where it finds that it's just finding some kind of abnormal cell or something to that degree that different doctors will describe. The reality is people have hidden infections and toxins in their tissues which have been suppressed over time by taking medications, which causes candida growth and causes some more immune imbalance, which is suppressed by other medications like sleeping medications or cough medications and other different preservatives and chemicals that are in our foods and so on. So these different chemicals and these different infections that are suppressed by these medications and vaccines as well are still inside your tissues, and they are causing your immune system, or let's just say that your immune system is responding, that's better stated, your immune system is responding to these hidden infections and toxins, whether they're in your bone marrow, in your stem cells, in your lymph tissue, in various organs, in your brain, in your spinal cord, in your spinal fluid, wherever the case, wherever these infections are hidden, wherever they're causing interruption in your body's normal function, your immune system is doing its only job that it's programmed to do, which is fight and remove, kill and remove the invaders. So if you have a chronic strep throat when you were younger, or chronic ear infections when you were younger, or you had fevers as a little child, or you had some other kind of maybe a sexually transmitted infection that didn't result in a discharge from your genital area, you can have infections that are still lingering all these years later, whether you're 20 years old, 15 years old, 35, 45, 65, wherever in between, with a lupus diagnosis or any other autoimmune disease as it's characterized, any other autoimmune disease for that matter. These infections must be found and they must be eliminated safely. And that's what I'm here to report to you. That's what I can do. I have a very unique system. I provide a very unique system for patients for these chronic diseases. And this system is based on work that was discovered by biophysicists and quantum physicists, where aligning with some form of homeopathy, or a very advanced form, I should put it, where we can actually make remedies out of the infections that I find with using a very unique stress reflex analysis system. And this analysis will help me find and pinpoint exactly in which tissue the infection resides. There is no blood lab that's going to tell you, or stool, or saliva, or urine test that's going to tell you exactly which infection is in which tissue. Let me be clear with what I just said. You can find an infection in a blood test like mycoplasma, or herpes infection, or Epstein-Barr virus, or whatever it is, or influenza, or whatever these doctors are going to find in you. But the problem with those tests, with those blood and urine or stool analysis, is they can't tell you from that test where the infection is residing in which tissue. I mean, they're not going to tell you which tissue the infection is located in, number one. Number two, they don't have an exact method, a precise method that's going to remove that infection without causing some other kind of side effect, without some other chemical input into your body that's going to cause some other kind of reaction in your body that's going to destroy the whole ecosystem of your body, the whole biology, the whole human microbiome. So we've got to use a specific, exact, precise, and safe stress reflex analysis system, which I do every day in my clinic, where I can find in a particular tissue, and we'll know in that exact tissue, which I'm going to describe in these exam findings in just a few minutes, which infection is within which exact tissue. There are various, I have over 40 different samples of various bacteria, and probably again over 30 different parasites, and many different virus samples, and mold and fungus and anesthesia chemicals and antibiotic substances, as well as different chemicals like heavy metals, like different compounds of mercury. And it's not just one mercury, there's different compounds of mercury that you may have absorbed over time, causing some imbalance or some malfunction or inflammation in your body, as well as all other heavy metals and cancer-causing food additives and other preservatives, as well as insecticides and pesticide chemicals that have been sprayed on the foods that you can have absorbed. These are what I use in my clinic to find what's in you, and we can make identical duplicate copy remedies out of these that will, if you follow the law of similars, or a term called like cures like, we can give you the remedy at a specific potency that's going to remove that infection from the exact tissue where we found it, so that your body can finally settle down and you can read your symptoms. Again, this patient, 42-year-old female, lived with a lupus diagnosis. She lived with the symptoms since 2011. She was diagnosed in 2012. She lived with various medications, including, again, prednisone, plaquenil, and low-dose naltrexone. She was taking those with other medicines as well, and various supplements that provided her no relief. And now she is no longer suffering insomnia, no longer until the drive down here, which I believe the electricity of the car caused this, heart palpitation, no more inward trembling, no more nervousness. She said that she has the shoulder blade pain that was a 10 in severity is now to a 2 or even a 0. It's on and off. The joint pain without meds pre-care, with meds pre-care. With her lupus meds, she was at a 10 in severity with her joint pain, and she's now 0 joint pain. She had to use a little bit of ibuprofen in between, which never helped her before, which now it is, and the sore throat is much less extreme. We still have to work on, there is another symptom that's lingering, which is a chronic fatigue. That has not changed with her, and that will change with this work. And she had her hands, she actually had a very intense weakness or swelling that caused her inability to open up a jar or to hold on certain items. She had complete resolve of that discomfort or swelling in her hands until the drive down here. So I really believe that the 10-hour drive in the car getting down to my clinic in Florida from Georgia is what actually caused the heart palpitation to return when she came down here, as well as the hand symptom to return. So, but that will all be resolved, and she did purchase some items in here, some products that we carry that will stop the electrical stress from the vehicle from causing any damaging stress to her tissues, which, by the way, if you do any of research to understand that electricity is causing chronic disease, there are articles, I'll put a couple up here on the screen, about how electromagnetic field stress damages our DNA. It causes double strand breaks in the DNA. And when you look at the DNA double helix, there are bridges, if you will, or double strands that connect one side of the DNA helix to the other. And those double strands can break from cell phone, Wi-Fi, radiation, as well as the electricity in the car, your computer, your tablet, your home. So there are devices that have been created that can stop the harmful electromagnetic field stresses or electrical interference from damaging your own DNA. And if you really understand, when you look at lupus, you can, on a laboratory assessment, while in one person they could have only an A antibody, in another patient they can find anti-DNA antibodies. So when you can understand down to the level of the high amount of these 4G LTE type electromagnetic field stresses from all the cell phone towers around you in the city, as well as Wi-Fi towers and Wi-Fi modems in your home, and the circuit breaker in your home, and the cell phones and the tablets and the computers, and everywhere you're driving, there's so much electricity influx into our body that it is causing a lot of damage. It's causing blood cell congestion in the bloodstream, and a number of different things are going on in people's bodies. Her first protocol, which brought her all of this relief, which again, she's not done, we still have more work to do, but brought her to that level of relief that I reported already more than once in this video. In her first round, I found her primary diseased cell, the primary most degenerative tissue in her body, the weakest link in her body, were her stem cells, also known as hematopoietic stem cells. These are the cells within your bone marrow which produce your blood. These cells in your bone marrow, your hematopoietic cells, make your red blood cells, white blood cells, and your platelets. She had tuberculosis bacteria infection in her hematopoietic stem cells. She also had Treponema pallidum, a destructive spirochete bacteria, which destroys stem cell function when it's found in there, and that can destroy the body's ability to not only have the proper immune response, but even have proper amount of red blood cell and oxygen in the red blood cell. She also had other infections like gonorrhea. She had multiple parasitic infections. She had tuberculosis residues. She had Bartonella henselae, which is also known as cat scratch fever, cat scratch infection. And she had scabies infection in her hematopoietic stem cells. The gonorrhea, first of all, I just want to report about that. The gonorrhea infection can come from generations past. That doesn't mean that she got it, whether she did or didn't get it through having some kind of intimate relations with another person while she's been alive on this planet. The research shows that there's infections that can pass on from generation to generation and generations past. So maybe somebody in her bloodline got infected from 500 years ago with a bacteria, and it stayed in the bloodstream, and it just keeps on reproducing and going through and getting into the new offspring so that these infections don't die. They have a survival of the fittest mechanism in them as well, just like human beings. And these bacteria want to live, they thrive, they survive, so they can use us as vehicles for them to continue their survival and thriving on this planet. So there were several infections in her first round where we made remedies to remove those infections from her hematopoietic stem cells, and that provided some of the relief. that I reported already. I found in her red blood cells, she had Lyme infection in her red blood cells. In her reticuloendothelial system, which are fibers that make up your bone marrow, your lymph vessels, your organs are made of these reticular fibers of your reticuloendothelial system. And the other part of this word called the endothelial of the reticuloendothelial system. The endothelial term is used to describe the inner lining or inner surface of every blood vessel in your body. Blood vessels, including arteries, veins, capillaries. You have these blood vessels in your brain, to your skin, in your bone marrow, in your liver, in your pancreas, to your gallbladder, to your stomach, to your bones, to your muscles. Everywhere has these endothelial tissues. In her reticuloendothelial system in the first round, excuse me, I found Candida albicans, I found parasitic amoebas, as well as another very harmful bacteria called Anaplasma bacteria that was also causing a chronic inflammatory mechanism, what doctors call autoimmune. The body's just turning on itself. Well, that's just not reality. The reality is the body is doing what it's supposed to do. It's attacking these infections, but their medications are not finding and removing these infections, so it's a chronic so-called autoimmune response. Her capillaries were infected with Bartonella henselae also. Her bone marrow. Listen, let me go backwards a second. When your capillaries are infected, your capillaries, the job that these tiny blood vessels do is they exchange the oxygen supplied to tissue and they take out the carbon dioxide from the tissue. So they have to remove the carbon dioxide, which is very toxic to our tissues, which robs the tissue of oxygen, and they help to replace the oxygen flow to the tissue. What would happen when those capillaries are infected? Number one, you're going to have an inflammatory mechanism against these capillaries, which are everywhere in your brain and your body. Every little, if we can even call the smallest, which is smaller than millimeters, nanometers, every tiniest surface of your body has capillary support. The capillaries infected, you're going to have an immune reaction against every single tissue, because where there's capillaries helping blood supply to your tissues, you're going to have an inflammatory mechanism by your own white blood cells attacking those tissues. That's the reality. Her bone marrow had gonorrhea bacteria. Wherever there's this infection, this bacteria, which does not have to show up on a sexually transmitted disease test. Why would it not show up on an STD test? Because these infections have been around for billions of years and they can evade detection. They are pretty smart little critters. They can evade our blood test detection, as well as when somebody is taking an immune suppressant medication, you may not see the infection in the test. So it's very simple. If mankind in the United States Air Force has the ability to create an airplane called a stealth bomber, let me use this analogy to help you understand something, folks, because if you're listening to this, that means that you're dealing with these symptoms from lupus and you're not well and you want to get well. So let's open up and understand a whole different way of looking at this condition, because you can get well with this work and I can help you do that. If we have a stealth bomber that can evade detection from radar detection in the sky, the stealth bomber, these brilliant scientists, whether they're from the Air Force or whatever plane company or NASA has been able to create an airplane that can evade radar detection. If airplanes were first created in the early 1900s, and now in the year 2000 we have a stealth bomber that can evade radar detection, in just 100 years we have this technology that can evade radar detection. A billion-year-old bacteria probably has become smart enough to evade some detection from our blood tests. Just understand that. The more penicillin, the more of these antibiotics that you're using is causing your body to become interrupted, and you can't even show that you're fighting the infection. Another finding was cartilage in her tissue, which is everywhere throughout the body, gonorrhea bacteria. The fascia tissue, which is underneath all of your skin, it's in your joints, it's around your muscles, it's around your organs. Fascia is everywhere in the body. Her fascia was infected with gonorrhea. The white matter of the nervous system, the white matter is tissue which we have covered with myelin, and it allows us to send motor signals from the brain down the spinal cord out to our organs and our muscles. And her white matter was infected with gonorrhea and parasitic flukes. In her brainstem, Here's another tissue that you deserve to know about. You have a tissue in your brainstem called the reticular formation. That's different than the term I used earlier in this video called reticuloendothelial system. But the reticular formation is an area within your brainstem that regulates your circadian rhythm. It regulates your sleep and wake cycle. It is the part of the brainstem that is supposed to be in control of stopping pain in your body. It regulates digestion. It helps to control your facial functions, eye movements, mouth and tongue movements. It helps to regulate your heart rate. Your reticular formation regulates heart rate, or it's at least one piece of your nervous system puzzle that regulates your heart rate. Your reticular formation also produces brain chemicals like serotonin, like GABA, anti-anxiety. Dopamine comes from this area where the substantia nigra resides in the brainstem, for those who know about Parkinson's. There's all these different brain chemicals that are first created in this reticular formation. So what happens when the reticular formation gets infected with what I found in her, multiple parasitic infections? How can her reticular formation regulate her heart rate when it's infected? How can, if you have a throat infection and you have a malfunction with swallowing from, let's say, a strep throat, streptococcus bacteria in your throat, how can you regulate your swallowing when your throat is swollen and infected? Does that make sense? You got to get rid of the infection so you can swallow normal again. What happens when your brainstem or your reticular formation has infection of parasites in it, like this patient had in her first round? What happens, or before the first round, before I even met her, it was there. What happens when it's supposed to regulate your sleep and wake cycles? What happens when it's supposed to stop your pain signals in your body? What happens when it's supposed to produce your serotonin and it's supposed to stop your heart palpitations? What's supposed to happen? You're going to have malfunctions. Isn't this making sense? And you can have an immune attack against this tissue because the immune system is finding parasites in that brainstem tissue. The next tissue I found was parasitic flukes in her liver. I also found candida in her spinal fluid, her cerebral spinal fluid, infected with Candida tropicalis. I found in the main blood vessel traveling from the heart out to all parts of the body, bringing blood to all organs and tissues, called the aorta. I found a Giardia parasitic infection. I found in her left and right kidney, I found parasitic flukes at an alarming amount in her left kidney. I found the same parasitic flukes in the right kidney, less of them, but still there, causing problems in those kidneys, which can help to regulate your heart function, your blood pressure, your energy, and your bladder function, and so on. I found in her spleen gonorrhea bacteria. So that was the general overview of what I found in her first examination. And again, she had great relief of symptoms following that first protocol, yet there's more to do. So let's listen to the second protocol, and I won't have to see her. After her first protocol, she did all of those steps at home. She followed all of the protocol that I outlined for her at home. Very simple, a simple remedy protocol. And I did not have to see her for 69 days from the day she started her protocol, 69 days. In her second protocol, I will not have to see her for 61 days. That will be the earliest exam follow-up. In this second examination, and again, she's still dealing with fatigue. She still has some symptoms like still a bit of the throat soreness. She has an allergic reaction, which we think was from food, but the mouth gets swollen and eyes were swollen. So that only happened from eating 2 different food items. And so I believe that all these symptoms are going to totally disappear. Whether it's in this second round or it takes another round with her, it will happen, and we're getting the job done. Listen to this next examination, what these findings. She had, in her second examination, her hematopoietic stem cells, again, the cells that make your blood, the stem cells making your red blood cells and white blood cells and platelets. She had a very high level of Salmonella bacteria, commonly found from, maybe she had it from eating chicken or eggs sometime in her life. Who knows where it came from? She had E. coli bacteria in her hematopoietic stem cells. She had also scabies infection. She had organochloride pesticides or organochlorine pesticide chemicals, which have been proven in research in rats and mice to actually cause anemia, to cause fatigue, to cause less than normal function of the human body. In her red blood cells, this time I found Treponema pallidum, a destructive bacteria. It's a spirochete bacteria. She also had in her dura, which is one of the layers of the meninges. Have you heard of meningitis? Meningitis is an inflammation of the meninges. Meninges are the covering, almost like if you can imagine a skin that covers your body's tissues. You have a covering over your brain and spinal cord, and the dura is the outermost layer. You might have heard the term called epidural, where they inject a numbing agent above the outermost layer of the meninges, the dura layer. The dura was infected with the same Treponema pallidum, a destructive bacteria causing inflammation. The hypothalamus brain is the chief organizer of all hormone function, and it also has to receive signals from our glands and other tissues in the body, so it knows what to do. So there has to be communication of the hypothalamus with all other tissues in the body. Her hypothalamus was infected with a large amount of the same destructive bacteria called Treponema pallidum. Her thyroid gland infected with the same Treponema pallidum. These both in the hypothalamus, as well as other tissues I've mentioned so far, can be causing her chronic fatigue. We're going to find out when she returns for her next exam. Her ovaries are infected with Treponema pallidum. The pylorus, where the stomach meets the intestine, it's called the pylorus. It's a sphincter or a muscle that's at the bottom of the stomach that opens up and lets the food from the stomach drop down into the intestine, and then it closes again. The pylorus infected with Treponema pallidum. Her stomach infected with Treponema pallidum. Her bile duct from the liver to the gallbladder, which also goes to the intestine. Her bile duct infected with Treponema pallidum, a very destructive bacteria. Her pancreatic duct infected with Treponema pallidum. The bile duct and pancreatic duct are really important tissues to help us regulate our digestive systems. We've got to be able to get our enzymes and insulin from our pancreas into our intestines through the pancreatic duct. What happens if there is an inflammation process going on in there because of an infection in that duct? We may not have a proper insulin or digestive enzyme to go through that pancreatic duct into our intestines. And when it's in the bile duct, we don't get the bile acid. We can't have normal digestive function when we have infection in the bile duct and pancreatic duct. I find that as well with all type 1 and type 2 diabetics that I work with, that there's infection in the pancreatic duct as well. Different infection perhaps, but I find that they're all the time. So the same destructive Treponema pallidum all throughout these tissues. I found in her ear eustachian tube in the ear, I found scabies infection. She gets an itch-like sensation in those ears. And the ear is also really important in the nervous system because it helps to regulate balance. It helps to regulate, it's even connected to parts of the brain that regulate things with blood pressure and a number of different functions of the human body, in addition to hearing. I found scabies in that eustachian tube. I found in her esophagus, which could be a connection to the sore throat that the minor, much less than what it was before, the sore throat she's still dealing with, but much less of a severity. I found the Treponema pallidum bacteria in her esophagus. I also found the Treponema pallidum bacteria in a nerve called the plexus celiacus. This is a bundle of nerve that comes out of your spinal cord, and it goes down to various organs like your pancreas, like your intestines. It goes to your adrenal glands. The plexus celiacus goes to a whole area of different tissues throughout your lower half of your body. What do you think happens when the plexus celiacus, this nerve that goes to these organs, is infected? Do you think the organs are going to function normally? No, they can't. Do you think that your body can feel normal? No, it can't. Do you think you might get fatigued because of this infection? You surely can, because this infection, like, for example, in her, a very big level of Treponema pallidum on her plexus celiacus, the nerve infected is going to not allow the brain signal to get to the organ, to get to the gland that the brain is trying to control through that wire that we call a nerve. And then what's going to happen is we're going to have another inflammatory mechanism, another what they call an autoimmune disease, because the body's attacking the tissue where it's finding this infection that the immune system is not overcoming. So what the doctors do is they give immune suppressive medications and anti-inflammatories to suppress the symptom instead of following a method of finding the infection with precision, which is what I'm reporting to in this video, finding the infection and ridding the infection. So we can get the job done when we use other true scientific methods, which is what I'm doing here, a purely scientific-based stress reflex analysis system where I'm going to be able to find in the specific tissue the specific infection and help you rid it with safe and effective remedies. The emotional center of her brain, treponema pallidum, and that is the end of this examination finding. So she will go on the journey now of removing these infections as well as the other toxins which I mentioned, like the organochlorine pesticide that's in her stem cells. She's going to remove these infections and toxin from her tissues. There is only one way this is going to turn out for her, and that is she's going to responding by getting better. She might, as others do, sometimes there are aggravations, not side effects to medications, but aggravations. Some people sometimes, to remove an infection, the body can have a diarrhea episode, or they might get a runny nose, or they might get a cough, or they might get a fever, or they might get a skin rash. As the body is exiting, it's removing the infections that are deep-rooted in the various tissues where it's going to leave the body. So the body has to find a way out. There is no magic wand that we can make poof, make the remedy just, make the infection just disappear into thin air. So there can be various aggravations that people suffer to get rid of these infections. Okay, but again, the amount of relief, insomnia relief, the heart palpitation relief, the inward trembling, the nervousness, the joint pain reduction, great. The sore throat, great reduction. The shoulder blade reduction, great. We still have a bit more to do. We're removing infections from the stomach. I believe that the reactions to her food, which were only 2 foods in her diet that she was noticed within the hour of eating the food, she had the swollen mouth and the swollen eyes. I believe that those are stemming from the infection that's in her stomach, and it's not a true food allergy. I believe that that's coming from the body just not being able to deal with processing the food. While, again, if the food is not organic and the body's reacting to a pesticide chemical, then of course, or an insecticide chemical, those can cause a reaction to a food, which it's not the food, it's the chemical that's on the food your body is not happy with dealing with. Now, because I always recommend organic foods when people follow my program. She couldn't do all organic. She didn't do all organic. But I believe that the infections that I found in her stomach, and the pylorus, and the bile duct, and the pancreatic duct, the treponema pallidum in those tissues, I believe that those are what's causing her reaction to the foods. And I believe that those reactions to those foods are going to completely disappear. She'll have no more of the eye or mouth swelling from those foods. And the other infections I found throughout the body, once the body can settle down, because once it carries out the disinfection and the detoxification processes that it will do in this protocol, once it can finally settle down, the other, like the allergic reactions are going to totally disappear, and the overall whole inflammatory process is just going to disappear in her body. So I'm happy to report this to you and for you. Anybody out there who's looking for answers to get well, and they're not hearing this kind of detailed analysis or even getting these results from the doctors they're going to, whether these doctors are 100% medical care or they're a kind of integrative medical type of practice or diet only practice, they're just missing the mark. You've got to find out which hidden infections and toxins are causing your inflammatory condition, and you can get yourself out of this disease, this chronic disease pattern. Whether it takes us a year to help you fix yourself with this work, or whether it takes us a few months, or maybe it takes a little bit more than a year, the job will get done and you will come out better on the other side. And we just have to put in work for a little while and you will be better. That I'm sure. So your body can reverse the condition. I never once said in this video, I want to be very clear for anybody who might make this statement to me in an email, I never talked about curing a disease at all. Your body is going to reverse the condition on its own, and your body is the only tissue, your body's tissues, your own immune system is the only thing on this planet that's going to help you reverse your disease. We just need to aid it in its process. Anybody out there who's looking to get involved with this work and get better, people do fly to my clinic from other states as well as other countries every week for this type of care. We're here in South Florida. You can call my clinic at 954-370-3100. That's 954-370-3100. Speak with my assistant, who's very happy to help you. She'll help you make arrangements here and how much time you've got to stay here, which is a very short. You can be in and out in one day in my clinic, from my clinic, and follow a protocol at home. Something else here. This information, if you found it useful, or if you're looking for a friend or family member who's sick with lupus and they haven't seen this yet, please share this with them. Share this with anybody you know. Just one click on your phone or on your tablet or on your computer, one click on any device of a share button. You can share it on Facebook, you can share it anywhere through email or text message. Share this with people. People who suffer with lupus do not need to suffer anymore just thinking that there's only medicine of an immune suppressant available for them. There are other methods, okay? Number one. Number two, share this video with anybody. Number two, you can follow me on my Instagram page. I do have various videos and other good footage I put up there. Sometimes that's not in my videos on my YouTube channel. You should also go to my Facebook page and like my Facebook page. I do put up information there on a regular basis, as well as subscribe here on my YouTube channel, and you can be the first to know when there's a new video that I put up of this different, very unique, and life-changing, life-saving information that I'm reporting here. Again, the phone number is 954-370-3100. And you can also, which I'll put the email to my assistant. You can send an email to my assistant and she can help you with any other questions. She will not be able to provide you exactly how I do what I do. That's my job in the consultation. We do have to do a consultation first, and then our examination is next. This, just to let you know in advance, insurance companies, insurance policies do not cover this type of work. You are going to have to be investing in yourself to get this type of help. They will not cover any part of this type of work that I'm offering you. Okay? Call my clinic or email, and we're looking forward to help you get better. See you soon.